St. Clara Waithera, a resident of Naivasha, is 16 years old. On her back is a lump which appeared after a bend occurred on her spine, a manifestation of scoliosis.
Sometimes no medicine helps to cure. It's pain that is quite excruciating.
It is a shocking matter to Marion Mwangi, her mother. She tells us that 11 years ago, her other daughter, St. Clair Wangoi, suffered from the disease and passed away when she was 11 years old while she was undergoing treatment in India.
When I first noticed with my second-born daughter, we tried searching in the family whether this has ever been seen or happened, and the answer was no. Currently, she is doing homeschooling, doing studies online.
I went to Form 1 at Komotai Girls School. I only did 1 month, but it affected me. I can't sit for a long time because I hear pins and needles in my spine. And whenever I walk from the classes to the dining hall or the classes to the dorm, I feel a lot of pain. Sometimes I stand somewhere to relax.
Despite the challenges she faces, St. Clara hopes to be treated and resume her normal life as before the illness.
I will be treated and go back to school and become a cardiologist one day, one time, because that's my career passion.
Life with scoliosis has been an uphill task, not only for St. Clara, but also her family.
Taking care of these children financially, it's quite draining.
Some simple things like traveling, you cannot travel with her in a matatu like any other person. So it's strenuous because you have to look for special means.
Scoliosis is when you have an abnormal curvature of the back towards the side. We suspect that it is genetic. If one sibling has scoliosis, it's more likely that another sibling will have scoliosis as compared to the general population.
In the event that scoliosis is not diagnosed early, the bend on the spine may affect other organs in the body and cause complications, particularly on the respiratory tract.
When you look at your child, you notice that when you look at them from the back, there is a deviation to one side or the other. If you look at the shoulders, you'll notice that they are not balanced. One will be higher than the other. When you look at the shoulder blades, you'll notice one that is a little more prominent than the other. These are the early signs.
Dr. Benjamin explains that often the arc in the spine occurs on the right side. At the same time, scoliosis is treatable.
The more severe curves are more demanding. You require more extensive and complicated procedures, surgical procedures, to treat the more severe curves. If you were to pick all scoliosis early, when the curve is of a small magnitude, the treatment in most of these is usually non-operative.
Marion says according to doctors in India, St. Clara has to undergo surgery 3 times to correct her condition.
One is to correct the twists and also to cut some ribs so that they can accommodate the lost height, and also put the rods to make her stand straight.
Following financial challenges, however, Marion's family is seeking assistance from the public.
Raising the 8 million is an uphill task, so I'm making humble request to all well-wishers to come forth and help me give my daughter a chance to live a normal life.
Ben Kirera, K24, Nairobi.